Austin Regional Clinic. She is an advanced practice RN and a clinical nurse specialist. We're so excited to have you here. She works in the field of ear, nose, and throat, so everything from here up she takes care of. She has a holistic approach, and she actually addresses the whole person instead of just that one little area. So she has kind of a unique perspective on treating the patient. She says, Kelly says that sleep is the unsung hero of health and wellness. She is passionate about sleep. She is also, and I'm not sure what this is, but she's a clinical herbalist with natural Texas plants for healing. And she's going to touch on that. I don't know anything about what that means, but she'll let us know. Everyone should have a little thing that they don't know what this is on the chair. Actually, if you take the top off, it's a hand sanitizer that you can spray on your hands. So it's not a purple marker, it's a hand sanitizer. And Kelly will talk to us. We'll have plenty of time for questions and answers afterwards. And then her cards are on the back table on the way out. If you have additional questions or need anything else from her. We are recording this, and Kelly has said it's okay to put her slides on the portal. So just listen, and you'll have everything available to you for the presentation and for the slides. So let's give Kelly a warm welcome.
All right, nice to meet y'all. I'm so glad everybody turned out. So I am the sleep specialist for Austin Regional Clinic. And you see over there, there's a whole lot of letters behind my name. There's a lot of letters over there. What does all that mean? I'm going to tell you what it means. So I'm an advanced practice nurse. So you know when you go to the doctor's office and you say, I need an appointment for the doctor that says, well, you can come by in about 3 months. And you say, well, I got a problem now. And they say, well, you could see our nurse practitioner or our PA, in a couple weeks. And so I'm one of those types of providers. I'm a different type of provider. I diagnose and I prescribe medication. I went to school at the University of Texas, which has one of the few programs in the nation for clinical nurse specialists who specialize in working with people who are over the age of 65. So I actually specialize in medicine, internal medicine, for people over the age of 65. And I work with all adults, though, and I decided to focus in on sleep medicine. And I want to teach y'all a little bit about today about a very common sleep problem called insomnia, which is when both sides of your pillow are hot or too hot. Anyway, just joking. But in order to understand a little bit about sleep, we need to know the different phases of sleep. So this is what's called a hypnogram, and this diagram, I'm not going to keep it, we're not going to have nothing but diagrams here today, I promise. This will be the only real diagram that I show you, but basically what it illustrates is that as we get farther in the night, from the first hour of sleep up till the last hour of sleep, maybe you get 8, maybe it's less, maybe it's more, but as the night progresses, we have long periods of deep sleep where our brain is not very active and our body repairs itself. And as the night progresses, we get longer and longer and longer periods of REM sleep, which is when our brain is very active and we are dreaming, okay? So the beginning of the night has more body sleep. The end of the night has more brain activity sleep with dreaming, all right? So there are different types of sleep and different categories of sleep. There's stage 1 sleep. Those are those waves that are kind of sleep. So sleep is a wave-like pattern. It's like waves of the ocean. Every 90 to 120 minutes, our body goes from light sleep to deeper sleep to REM sleep. Light sleep, deeper sleep, REM sleep. and it's very patternistic, like the waves of the ocean. The lightest phases of sleep are restorative for our body, but typically light sleep, stage 1 sleep, is more of a transition phase. It's like your body is getting ready for the next thing to come when you're in the lightest phase of sleep. Typically in the lightest phase of sleep, you might not even realize that you're asleep yet, but your brain waves have started to slow down. In the second stage of sleep, which is when we are in our time where we are sleeping, but it's lighter than our REM and our deep sleep, our body goes through metabolic repair. Our body replenishes our electrolytes. It replenishes the metabolites that help to modulate your mind, your memory, your emotions, your heartbeat, your muscles, and things. But many times people, as we get older, we tend to have more stage 2 sleep, and it doesn't feel as restorative as our deeper sleep, which is stage 3. Stage 3 is deep body sleep. Do you remember the last time you maybe did a lot of activity, like for me, gardening is that's a lot of activity, is gardening. You know, you're lifting stuff, you're bending down, you're doing a lot of work. And usually on a night when I do gardening, I wake up in the next day and I say, man, I slept like a log. I slept like the dead, because when we have a lot of physical activity, our body needs to repair, and we go through deep sleep where the brain is not really very active, but the body is repairing itself, and it makes for very much deeper sleep, okay? And oftentimes, the more stage 3 sleep that we get, and the more activity that we get, the deeper sleep that we get. Finally, REM sleep. Hang on one second, sir. I'm going to answer all questions at the end. All right. So REM sleep is when our muscles relax, and our muscles are totally relaxed, but our brain is very active, and we tend to have. This is the time when most people are dreaming. Dreaming sleep, we're honestly, as like a, science and medicine as a whole, we're not sure why we do this. There's a lot about sleep we really don't even understand yet. And one of the things is we don't really understand why we dream. What's the purpose of it? We don't really understand what truly happens in REM sleep, but we know it's really important because when people don't get enough of it, they say they don't feel rested. All parts of sleep are important and are natural and necessary for our bodies, okay? So sometimes we read things that say certain phases of sleep are more important than the others. They're all important, and they're all part of a natural, healthy sleep cycle. Now, our sleep cycles are very different nowadays than they used to be. Prior to the year 1879, now if we've got any trivia buffs in the class, I'll ask y'all in a minute what happened in 1879. But prior to the year 1879, our sleep looked very different than what it does now. People in what I call the rat race, that's people like me, who I gotta be in bed for 10, and I gotta be up at 6, so I can be work at 8, work until 5 or 6, be at home, cook dinner, be in bed at 10, get up the next day and do it all over again. That's the rat race. Y'all probably aren't in the rat race anymore. You've been through your rat race years, and now you can get up and go to bed whenever you feel like it. But prior to 1879, sleeping in this compressed manner, in what I call the rat race, where you have to sleep for 8 hours so that you can be up and then be back asleep for 8 hours, that was a very unnatural way to be. Prior to 1879, people used to go to bed closer to sunset, and they would wake up closer to sunrise, and not like they do now. And in the middle of the night, they had this big awake time where they were maybe awake for an hour to 2 hours. This was a natural way that humans have slept throughout the millennia, and it was called first sleep and second sleep. What happened in 1879? The invention of the light bulb. You got it. That completely changed our human evolution and the way that we sleep and the way that we have to do things. Because light in the evening time that's brighter than a candlelight is very disruptive to our sleep. It is one of the most disruptive things that you can do. But we got lights blazing all night long, all throughout the night. We got night lights. We got street lights. It's not only messing up our sleep, it's messing up the birds' sleep. I got a bird that's outside of my window at 3 o'clock in the morning just tweeting away from the street lights. So there's some different things that happen because this has changed. And there are a lot of really common sleep complaints that people come into my office and they say, hey, Nurse Coleman, I'm always tired. I think she just yawned right there. They say, I'm always tired. Or they say, I just can't get to sleep. My mind is going like nuts. I go to bed and my mind just goes wild. Some people say, I snore. Or some people say, the person next to me snores and I can't sleep. Or sometimes they just say, I'm a light sleeper. There's a lot of different sleep complaints that we have. And there's a lot of disease burden that chronic insomnia causes. Now, everybody's got a sleepless night now and again. Okay, everybody does. No matter how good a sleeper you are, you've had a sleepless night here now and again. But some people deal with this all the time. And what we do before bedtime can make or break our ability to fall asleep. And there's some different activities that people are doing up here that are making or breaking their ability to fall asleep. This activity can make or break your ability to fall asleep. This activity can make or break your ability to fall asleep because it has to do with artificial light. There are a lot of different things that can cause us to have problems sleeping. These are known as sleep disruptors. Caffeine too late in the day can cause problems getting to sleep at night. Our use of screens can cause problems getting to sleep at night. But of course, light and noise. Nicotine, a lot of people vape. They don't think about smoking because they don't have to go outside, but they'll be vaping in their home and using nicotine. That can disrupt our sleep. Stress, and then sleep hygiene means it's not whether you take a bath before bedtime. Sleep hygiene means what you do in the evening time to help you fall asleep and get ready for relaxation. This is one thing I hear a lot. I just can't shut my brain off at night. This is a big problem that people have, and we're going to talk about how to address it. There is a new sleep disorder that is a voluntary form of self-harm, and it is called insufficient sleep syndrome. Do you see what these people are doing here? They're in bed and they're on their screens. Now, maybe your screens look like this, maybe they look like a TV screen. And there are people who have no problem going to sleep, and I'm not talking about those folks. What I'm talking about is people who have trouble getting to sleep. If you have trouble getting to sleep and you cannot turn your brain off at night, then getting on your screen is one of the worst things you can do. There are a lot of people out there who don't have problems sleeping at night. They fall asleep just fine with the TV on. This message is not for them. But if you are a person who says, man, I can't turn my brain off, I get in bed and my brain is just going a mile a minute, getting on your screen is very harmful for you. Because it is a choice. Many people are making a choice to use their screen, and what they're choosing instead is they're choosing a screen over sleep. They're choosing a screen over their own health. And it's a type of self-harm that a lot of people do nowadays, especially since our screens are right there in our pocket. They're right there with us at all times. It didn't used to be like that. In cases where people are having problems getting to sleep because they can't turn their mind off, one of the reasons why one of the ways that to help turn off or to help you feel tired is exercise. Now, I'm not talking about going out and running marathons. Any type of exercise is important, because if you do not tire your body out, your body won't be tired and you won't be able to get to sleep. It's like that example I was saying earlier. I said, man, I was gardening and I just slept like a log. Or I went on that really long walk the other day and boy, did I sleep good. You ever watch a kid run around and you watch the kids or grandkids run around, they're running around everywhere all over the USA. You're going to sleep good tonight, right? That's because exercise tires the body out so that you can be tired. And I have folks come into my office and they say, but Nurse Kelly, I got bad knees. But Nurse Kelly, I got bad hips. And what I say to them is, do your arms move? Well, yeah, I can move my arms. Then you could do chair exercises and tire your body out. If you got bad hips and knees, your body would probably really love aqua aerobics, because you can strengthen your legs and get yourself tired at the same time so you can sleep good at night. Exercise is extremely important, whatever exercise you can work in. They even have chair exercises with silver sneakers online, and there's no excuse not to do it because it's free. Costs nothing. You get on YouTube, silver sneakers, chair exercises. But it's nice if you enjoy social interaction, which I discovered just how much I need social interaction through the pandemic, because boy was I lonely. So if you like social interaction, aqua aerobics is a great thing to do. Do they have that available around here? Fantastic. That's a wonderful way. But other things that if you are a person who doesn't like the social interaction, things like yoga, walking, something like that, can also help you get in the exercise that can make your sleep so much better and help you get to sleep and stay asleep more deeply through the night. Sleeping is being able to fall asleep is a learned skill. So many of us are so good at stimulating our sympathetic nervous system. The sympathetic nerve, we have two different ways that nervous system types in our body. We have sympathetic, which is known as the fight or flight nervous system, and we have parasympathetic, which is known as rest and digest. We got all kind of stuff to stimulate our sympathetic nervous system. We got coffee, and we got nicotine, and we got TV, and just about everything in our life that's exciting and hops us up. It stimulates our sympathetic nervous system, okay, the fight or flight nervous system. But in order to be able to fall asleep, we have to be able to develop the skill of our stimulating our parasympathetic nervous system, which is the rest and digest nervous system. And this is that mind-body connection that a lot of people are talking about nowadays, and developing the mind-body connection, okay? What does that really mean? What does that look like? That sounds like a lot of hocus-pocus type of, like what does it really mean to develop a mind-body connection? Well, in sleep medicine, what it means is kind of relearning what it means to the way that babies fall asleep. So how do you get a baby to fall asleep? Now, you don't have to have children. You just have to have been a child to know how to get babies to fall asleep. Well, first you feed the baby, and it has to do with routine. Our body really responds to routine when it comes to learning how to stimulate the parasympathetic nervous system, which helps us calm down and get ready, so our body and our mind know that it's time to wind down and go to sleep. So how do you get a baby to sleep? First, you feed the baby at 6 p.m., and then you give the baby a bath at 7, and then you put the baby in the pajamas, and then you read the baby a story, you give them a drink of water, and by 8 o'clock you turn off the light, and you do that every night, every night, every night, every night. And the baby's brain learns a routine. And this routine is called the circadian rhythm. Have y'all heard of the circadian rhythm? That's what that means. It's body's routine. It knows when we're supposed to eat and it knows when we're supposed to sleep. But when we stimulate ourselves constantly with screens, our body doesn't know when to relax anymore. And so many people who suffer from problems being able to fall asleep have to relearn how to stimulate their parasympathetic sleep and our rest and digest nervous system. And a lot of it is from these routines that help feed into our circadian rhythm, or the rhythm of our body's 24-hour day. One way to help your body to know when to rest is to wake up at the same time every day, even on weekends. Now, this is a little more important in people like myself who are still in the working world, or what I like to call the rat race. And we have to be up, because what we do is we shortchange ourselves. I say, well, I really want to watch this movie, or I really want to hang out with my friends or whatever this night, so I'm going to go to bed late because I know that on the weekend I can make up the sleep. So I'm going to shortchange myself and only get 5 or 6 hours of sleep during the week, and I'm going to make it all up on the weekend. So what we do is we're robbing Peter to pay Paul. But waking up every day, even on the weekdays and on the weekends, what that does for people is it prevents them from robbing Peter to pay Paul. What it does is it prevents them from depriving themselves of sleep during the week and trying to make it all up on the weekend, which is unfeasible for many. Also, turning off screens an hour prior to bedtime. So these are the two main pearls that I would say are very important for people as they're relearning how to help themselves get to sleep in the evening time. Things that we can do to relearn how to stimulate our parasympathetic nervous system. Now, you don't have to go to 6 p.m., feed yourself 6 p.m. and then take your bath and whatever like a baby. There's other things that we as adults can learn to do, and these are relaxation techniques. Maybe you have a tea ceremony you do in the evening. You have a cup of herbal tea, and you have a lovely tea set that you use, and this is part of your winding down technique. Or maybe you read in the evening, or maybe you do yoga, or maybe you take a bath, you have sex, you do a Sudoku puzzle. I don't care. It doesn't matter as long as it relaxes you. That's the main thing. Whatever you're into, some people pray, some people meditate, some people have a tea ceremony. It doesn't matter what it is, but all of these are behavioral methods to help create the mind-body connection that says this is the time when we slow down. And we do not stimulate our minds with screens. We slow down so that we can go to bed easier and have our minds slow down. Sometimes these behavioral methods don't work, and people get into a lot of trouble, and they've tried everything. I have a lot of people that walk in my office and say, I've tried everything. I've tried yoga, I've tried tea, I've tried marijuana, I've tried everything. You tell me one thing and I've tried it. And so sometimes sleep gets so bad that we have to be on medication, okay? And there's a lot of medications that if you have sleep problems that you may have been on over the years, but not every medication is the same. There are medications, all the different medicines that we have work on a different hormone of the brain. Many of the medications that you may have heard of, like the really strong ones like Ambien, work on the hormone GABA. And then, of course, melatonin is over the counter. There's and histamine, there are certain histamine drugs that are over the counter. But each sleep medication works on a different hormone of the brain, and they work in different ways. And some of them are safe, and some of them are more safe, and some of them are less safe. If you are in a situation where you've tried all the conventional methods and you've tried the relaxation techniques, and you're in a situation where you're not sleeping well and your health is suffering and you need to take a medication for a short period of time, there are a lot of choices out there now that won't get you addicted, that are non-narcotic, and they won't get you addicted, and they're safe. But that probably needs to be a more in-depth conversation with a professional like myself about medications you've tried, okay, and failed. But there are safer alternatives. Also, some people don't have to take medicine every night. And there's a lot of different medications that you can only use on nights when you know you're going to have trouble. A lot of people walk in and they say, look, when I got a doctor's appointment the next day, I can't sleep. And they get all worked up and they're nervous. And they can't sleep the night before. So maybe you only take a sleep medication on the night before you know you've got that thing going on the next day. Some people, another way to do it is some people say, you know, some nights I can sleep, other nights I don't get to sleep the whole night. So one way to work with medication, if you want to work with medication, is if you're in bed and you're not asleep in 30 minutes, then you go take your medicine. But you don't let it go for 2 or 3 hours. Don't let it go for that long. That's another way to work with medicine. And one other way to work with medicine is you take your medications an hour before bedtime, and once you take that medicine, all the screens go off, and you start doing your relaxation techniques, because the pill helps to drive the skill, okay? So that's what I want to talk about, is what are realistic expectations of these skills like yoga, meditation, tea ceremony, taking baths, going for walk. You know, what's the realistic expectations that you can look for in a pill versus a skill? A lot of times in people with bad case of insomnia, they need both. They need a pill and they need to learn a new skill. About the best you can hope for in a sleeping pill, the best you can hope for is that you'll sleep 6 hours at most, 8 out of 10 nights. That means 2 out of 10 nights you might not sleep at all. But 8 out of 10 nights you're going to get hopefully at least 6 hours. And we're going to try and find a medication or combination of medications that can get you to sleep in under 60 minutes. But if your anxiety is so unmanaged, that can undo this. So anxiety's got to be managed. You got to be working out. You got to be doing the mind-body connection stuff. Okay? Let's talk about some over-the-counter medications that have been in the news lately. I don't know if y'all have seen this thing about Benadryl causes dementia. Have anybody seen Benadryl causes dementia? Yeah. Well, I want to talk about that. Benadryl does not cause dementia. Benadryl does not cause dementia. But if you have memory problems and you are chronically dehydrated and you are over the age of 65, or let's rephrase that, if your liver is over the age of 65, and if you have, if you take Benadryl or medicines like Benadryl that dry you out, then it can contribute to a temporary case of not exactly dementia, but it can exacerbate memory problems. So if your liver is over the age of 65 and you have had falls in the last year, Benadryl is probably not the medicine for you for sleep. But if that doesn't apply to you, Benadryl can be safe, is very safe. So let me repeat that. Number 1, Benadryl does not cause dementia. Number 2, Benadryl is probably not safe for people who have memory problems, are chronically dehydrated, and who have fallen in the last year. If you have sleep problems and you need sleep medicine frequently, it's probably not going to be a good idea for that person. However, if you're pretty healthy and you have not had falls or memory problems, have at it. Okay. Another thing that you may have seen is melatonin's bad for you. Nope, wrong again. Melatonin is a hormone that your brain produces in the pineal gland. It is a natural hormone that you produce every single day. You have been doing it since you were a child, and you will do it until the day you die. Taking melatonin is safe. But a lot of people with sleep problems, they guzzle that stuff thinking they can take. I had a lady who came in saying she's on 80 milligrams. I said, oh my God. Melatonin, the max dose of this stuff, is no more than 10 milligrams. And there was some studies that came out. It's really best to take the tablets, not the gummies. Gummies have they taste good. They taste like candy. They basically are candy. You might as well give them to the kids for Halloween. Because there's no guarantee of how much melatonin there is in there. That's because they have done studies on the gummies, and they're very inconsistent with their dosage. Many of those gummies don't even put a dosage on there anymore because they can't even guarantee how much is in there. So take the tablets, but not the gummies, and never more than 10 milligrams. Okay? So let's talk about herbs. Who knows what this one is? Have y'all been to Colorado lately? They sure do got a lot of shops there, don't they? Anybody been to Colorado? Yeah, a few of y'all. They got shops everywhere now. And there's a lot of people using this. And that's fine. That's fine and dandy. But here's some things we need to know about it. Because y'all got friends who've been to Colorado, and they said, oh, we brought back some of them gummies. Y'all want to try some of them gummies? Anybody heard about the gummies? Or have friends that bring back the gummies? Yeah, I do too.
It's illegal to take it across state lines.
It is illegal to take it. You beat me to the punch, lady.
Yeah.
What are you getting paid for this or something?
I didn't know that. It's illegal.
It's illegal to take marijuana across state lines because it's illegal to have it in Texas for non-medical purposes. There are a few medical purposes currently in Texas, but it is not legal in Texas for recreational use. Does pot get you sleepy?
International.
Gets me sleepy. Back in the 90s, I smoked pot. I'll freely admit that. And it made me real sleepy, and it'll make other people sleepy too. But nowadays, so I'm an herbalist. Okay, that doesn't mean like Willie Nelson, smoking herb, whatever. I'm not that kind of herbalist. But marijuana is an herb that is used for a number of different uses, but it is not legal to have it in Texas. It will make you sleepy, okay? However, you need to use some care if you have some friends and you want to experiment and try this, okay? And especially if you want to use it for sleep. It will make you sleepy, however, it's very, very strong nowadays. They have done a lot of work with breeding of plants. And the marijuana that you remember from the 60s, 70s, and 80s is now 1,000 times as strong as it was back then, no joke. It's 1,000 times as strong. The plant itself, because they've done so much breeding. It's like how tomatoes didn't used to be this big, but all through the plant breeding, and now they're this big, It's like that with pot too. It's really strong nowadays, so be careful. Know about the milligrams, okay? Because it can be very strong, and it can cause a paradoxical reaction, which means the opposite of why you took it. You wanted to take it to sleep and to relax, and a lot of times it's really strong, and it can make people very paranoid and have negative feelings, okay? So just some things to know about. As an herbalist, it's just another herb. It's just another plant that has medicinal properties, just like all the other plants that have medicinal properties. But things are changing in our world now, so I want y'all to know about it. There are a lot of other plants that are legal, and if you love gardening, you can plant them yourself. Has anybody seen this plant in Austin?
What is
somebody said it. That is passion flower, and it is a well-known plant that can help those circular thoughts that spin around in your head, and it makes a wonderful, delicious tea. And if you see it growing on someone's fence and you know they're not spraying it, then you can collect it and make a lovely tea out of both the flowers and the leaves. Does anyone, well, this one's a little harder. Anyone know what this one is? This one is called Piper methysticum, or kava kava.
Oh,
Kava kava is a very strong medication for sleep. Tastes like hell, works like heaven. So there are a lot of plant medicines that we have that grow here in Texas, like vervain and skullcap and Mexican hat and passion flower, and you can grow, I'm having a brain freeze, valerian. I grew valerian in my garden this past year. Grows really good on our oak tree, likes a little bit of shade. And all these plants have lots of medicinal uses. But one of the things that if you enjoy nature and you enjoy the natural world and you like learning about plants in your own natural environment that grow here in Texas that can help us sleep and many other things, I would love it if you went on a plant walk. The American Botanical Council has a beautiful facility over in East Austin where you can do a plant walk, and they will talk to you about the different plants that grow here and some of the different plants that are in their gardens. Also, you can go into hill country and they do plant walks, so it's called a plant walk, okay? They do them with the Sacred Journey School of Herbalism. They do it with the American Botanical Council and many other places that offer these. And you can learn about plants that are in your natural world, that you'll be on a walk in your own neighborhood here and see the different plants that are helpful for various, conditions, such as having trouble sleeping. But if you want to do something that's a little bit more, and then there's a lot of supplements too that people are taking nowadays. So let me flip to my next slide. How do you know what to take? How do you know anything about it? You read these stuff on Facebook. It says, take ashwagandha for sleep. Well, what part of the plant? Do I take the berries? Do I take the leaves? Do I take the stems? Do I take the roots? How do I take it? Do I take it in a tea? What do I do with it? How are you supposed to know? Because you didn't go to school for that, right? There's a lot of supplements nowadays too. And there's a wonderful website, an app. If y'all like apps on your phone, there's an app called About Herbs, and it's a very good website. It's from Memorial Sloan Kettering Hospital, and they have all different plants, information about really good medical information about plants. So if you're using a plant, like a lot of people use turmeric, a lot of people use ginger, a lot of people use valerian, and y'all can learn about it more there.
And what is that?
That is called About Herbs, and it's a free app. If you have insomnia, traditional Chinese medicine is a really good, helpful type of treatment for people who have anxiety-related insomnia and who are not wanting to take pills, at least not prescription pills like people like me prescribe. I'm gonna be honest with y'all. I did not go to school to know how when you put needles in somebody's body it helps them. I didn't go to school for that. I went to school for something else, Western medicine, okay? But we have a lot of wonderful evidence that shows that traditional Chinese medicine is very helpful for people who have trouble getting to sleep because they are so anxious. For example, I had a patient who came in, she said, I can't get to sleep. I stay awake all night and I finally fall asleep at some time in the morning. I said, how long has this problem been going on? She said, 5 years, 4 months, 10 days. And I said, well, what happened 5 years, 4 months, and 10 days ago? She said, my husband died. She hadn't slept in 5 years because of her anxiety, because the man she had been with she's not next to her anymore. For that type of anxiety, that prevents us from being able to get to sleep. Chinese traditional medicine with acupuncture and herbs is fantastic for that. Now, there's lots we can do in Western medicine too, but there's a lot of people who aren't interested in that. But there's great evidence for that. So one problem about this is it's expensive, and it might not be covered by your insurance. So how do you see a Chinese medicine doctor if it's not covered by your insurance? You're in luck. You happen to live in Austin, Texas, and we have 4 different schools of Chinese medicine here. Thank you, Linda. And so if at the end, I can give y'all some information because I'm being told it's time. But if you are looking for an acupuncturist who will go to your home, NCCAOM, here is the acronym right here, is a website that can show you if there's an acupuncturist in your area who does house calls. Guess what? They do house calls. Western doctors like me, we don't do house calls, but they do. Okay? And they can come and they can come to your home and help you with acupuncture and herbs. Let me just get through my last little piece of this. If I could give y'all one take-home message, it's that no matter what you do, no matter what you take, if your screen, if your TV is on, you will be awake. But now this does not apply to people who have no sleeping problems. This applies to people who have insomnia, okay, who can't get to sleep. Screens are more powerful than our strongest sleep medicine. Screens are more powerful than Ambien. They are more powerful than everything. They are the dopamine hit that lives in your pocket, and they are more powerful than drugs. So if I leave y'all with one message, it's that if you are having trouble falling asleep and getting to sleep at a reasonable hour, to turn the screens off an hour prior to when you are wanting to go to sleep, okay? There are a lot of other things that we could talk about sleep, such as what's keeping you from staying asleep. But I want to open up the floor to questions, and for anybody that's got questions. Debbie's got a microphone over here. Yeah, there. There was a gentleman that had a question right at the beginning. This gentleman right here in the blue shirt.
Who has?
Harry?
Does anyone? Manny, did you have a question?
I think you covered that. You were talking about what you can take at night. We include alcohol in that, and you did. So.
And what was it?
Alcohol.
Alcohol. Oh, alcohol. Yes. So alcohol is what is known as a sleep disruptor. Alcohol is tricky because for most people, myself included, it really helps us fall asleep. It relaxes the mind, but in all cases, it does disrupt sleep. Decades of research has shown this. Thousands and thousands, tens of thousands of patients who have had sleep studies showing the effects of alcohol. So it is true, it does help you get to sleep, but it does disrupt sleep. It tends to make sleep more disrupted and choppy. That hypnogram that I showed y'all at the beginning does not look very wave-like, even if we have just 1 or 2 drinks. So if you have trouble staying asleep, here's what I would say about alcohol. Alcohol is wonderful. I love it. I enjoy wine myself. However, if you wake up in the middle of the night and you have trouble getting back to sleep, keep your alcohol in the earlier hours. That would enjoy your alcohol, but make it be in the earlier hours. If you are having trouble staying asleep and getting poor sleep quality, waking up not feeling rested, keep your alcohol earlier. This gentleman had a question from the very beginning.
You talked about having medicine.
Can't hear you. Can't hear you.
When I get up in the morning, that's when I do my work. missing something by making it so early in the day.
No.
No, okay, thank you.
No, you're not missing anything by doing, so the question was, what if I like to do my workout in the morning time? That is just fine. You don't have to work out at a particular time or do your physical work of the day at a particular time. You just got to tucker your body out so that your body is tired. So keep doing your morning workouts. Yes, ma'am.
So a lot of us wake up, have to go to the bathroom, middle of the night, and not always go back to sleep. What do you recommend?
That is a great question, Harry, because
Did you hear the question?
the question is, what if I wake up in the middle of the night and I go to the bathroom and I can't get back to sleep? And you hit on the stuff that I didn't get to, which is talking about a very common sleep disorder. The most absolute number one most common sleep disorder of them all causes people to wake up multiple times a night to go to the bathroom. If you wake up more than 2 times a night to urinate, there is a very high probability that you have sleep apnea and that you are choking in your sleep and you don't even know it. Let me say that again. If you wake up more than 2 times a night to urinate, there is a high probability that you are choking while you're sleeping and you don't know it. This is a problem called sleep apnea. The only way to stop peeing that many times a night is to start breathing. If you think that you have this problem and where you urinate more than twice a night, generally it's more than twice a night, okay? This even goes for gentlemen, all right? We all know that gentlemen can have some problems with urinating as we get older. It has to do with an organ called the prostate and it getting larger as we get older. But it's still abnormal to urinate more than 2 times a night. And that is a high probability of sleep apnea. The only thing that will help you to stop peeing that many times a night is to start breathing.
Do you have to snore?
That's a great question. So do you have to snore to have sleep apnea? Sleep apnea is not snoring. Snoring is different than sleep apnea. Now, many people who have sleep apnea do snore. I do. I got both. I snore like a bear wrestling a trucker. But many people don't ever snore at all. Some people, they wake up in the middle of the night, they wake up to urinate, they can't get back to sleep, they've never snored, not a day in their life. Many people who have sleep apnea do snore. It's more common to find that, but it's not always, okay? Snoring is not apnea. Snoring is up here. Snoring happens so during the day, while we're awake, we have tiny muscles that hold our throat open. And these muscles are involuntary. That means you cannot work out these muscles. They just work for you. There's no Richard Simmons snoring workout, right? There's no Jane Fonda esophagus workout. These are involuntary muscles. And these muscles hold your throat open. People who have sleep apnea, this is an inherited condition that we get from our mother or our father. I got it from my dad. I know exactly who I got it from. This inherited condition is where we inherit more flexible connective tissue in our throat. And during the day, these little involuntary muscles, they hold our throat open and they keep our palate lifted. We don't snore during the day, do we? Nobody says, "Hey, Kelly, you're snoring, stop it." No. That's because those muscles hold our throat open. The minute you fall asleep, your muscles relax. And when those muscles relax, if you inherited flexible connective tissue in your throat, then your throat can collapse. Now, when the upper part of your mouth of your airway collapses up here, a partial collapse, we will get vibrations of the excess skin that is supposed to be there, like your turbinates, your tonsils, and your septum. And all those vibrations of that, when that skin relaxes and the muscles relax, causes snoring sounds. But snoring is up here, and snoring means you're breathing. You're breathing loudly, you're disturbing everybody in the house. Maybe even the neighbors, I don't know. I've been to a hotel and been asked to leave before. Snoring is not dangerous unless your wife knows karate. But snoring is not bad for you. And surgeries that fix snoring are not going to fix sleep apnea. Because sleep apnea is not up here where snoring is. Sleep apnea is right here. Sleep apnea is at the base of your tongue. The part of your tongue, this part? No, it's the part of the tongue that you can't see. Sleep apnea is right here, and it's when the throat collapses. The tongue is a muscle, and it relaxes, and it blocks the throat, and then the air can't pass. And when the air can't pass, your heart has to work a lot harder. And many people end up with some heart problems over time because of sleep apnea. So why do we wake up to pee? Why does sleep apnea cause you to pee? How on earth could that happen? Here's how. When the oxygen gets so low that your body is going into panic mode, the heart takes the wheel, and the heart says, I'm not getting enough oxygen. And so what the heart does is it tells the kidneys to make more urine. It says, hey, make more urine. That's the only thing I know what to do. So the kidneys, they make urine, they make urine, they make urine, they make urine, and all of a sudden your bladder fills up. And a strong signal is sent to your brain. It is a backdoor safety mechanism. The signal is sent to your brain and it says, wake up now. And you wake up, and the very first thing that you do before you put one foot on the floor to go to the bathroom is you take a breath and you give your heart the oxygen that it needs to keep beating. And that is why sleep apnea is so detrimental for our cardiac health. Because every night that you sleep and you're not breathing properly, you have cardiac ischemia, which is the precursor to heart problems, high blood pressure, cardiovascular disease, and people with high degrees of sleep apnea are at very high risk for heart attacks. Sleep apnea is completely and utterly fixable, and it's simple to fix. It's as simple as this. Putting on a pair of glasses. It's as simple as that. When you fix it, we can talk about it later. Yes, ma'am.
What does your clinic do to diagnose problems? What does your clinic do to help diagnose and treat the problem?
Okay. Good question. The question is, what does my clinic, what do me or people at my clinic do to diagnose sleep problems? There are over 80 different known sleep disorders, okay? So most of the time, we got to do a sleep study. Sleep studies, now some of y'all had sleep studies and some of y'all hadn't, but in many cases, we would start with an at-home, in your own bed sleep study. They make a sleep study kit that diagnoses sleep-related breathing problems. And in many cases, we're dealing with a sleep-related breathing problem. Okay, these are home sleep test kits. They've been around for a long time, but during the pandemic, so many people needed a sleep study. Everybody still needed sleep studies, but we couldn't bring them into the sleep lab because it was the pandemic, and that was unfeasible. So we started using these home study kits, and they do a darn good bang-up job of identifying the majority of these sleep-related breathing disorders. So if you are having trouble staying asleep through the night and you need a sleep study, in many cases, we can do an at-home study now in your own bed with just a small kit. What's in the kit? Well, depending on the clinic. In my clinic, we use a kit that has an elastic band that goes on your chest, just like your bra band or like a fitness monitor band. And then there's a wire to your finger and another little wire to your nose. Okay, it monitors your heartbeats, your oxygen, and your breathing and sound, and then movement. Okay, they do still do these sleep tests in the sleep lab, and if you have to go to the sleep lab, boy, you got 30 wires connected to your body, all connected to your head and glued on your head and all over you. So we try to do these home sleep studies, okay? Because most people do a little better with 3 wires instead of 30. But if you do have to go to the sleep lab and you have problems getting to sleep or staying asleep, many times I will prescribe a sleeping pill for one night. Because what's the point of going into the sleep lab if you never get to sleep? What's the point of going to the sleep lab if you can't stay asleep? How are we going to get any data? You can't get data. So many times I will end up prescribing for one night, at least for one night, a sleep medication to help people if they have to go to the sleep lab and they have bad sleep problems. Does that answer your question? Okay.
Any other questions?
Yes, ma'am.
How long are sleep studies valid, the results of them valid?
The question is, how long are sleep studies valid? It depends. So if it's a sleep test for sleep apnea, sleep apnea doesn't go away. I don't care what anybody has told you, sleep apnea doesn't go away. And if you have a sleep study that said that you have sleep apnea, chances are I don't need another sleep study to tell me you still got sleep apnea, because chances are you still got blue eyes too. You inherited those from your mom and daddy, you inherited sleep apnea from your mom and daddy, you still...
What if it shows you don't have sleep apnea?
Well, sometimes it does, that's a different story. But many times, sleep apnea doesn't go away because it's an inherited trait. So the question was, do I need to repeat sleep study?
Right.
Most of the time I don't. However, I ain't Medicare. Medicare sometimes requires some repeat sleep studies for different reasons. Also, if you have a different sleep disorder, like let's say we do a sleep study and it's a home sleep study for sleep apnea, and we treat the sleep apnea, but you still sleep bad. Well, we might need to repeat a sleep study in the sleep lab because you might have a different sleep disorder. A home sleep test only looks for one thing, and one thing only: sleep-related breathing problems. There are 80 different sleep disorders. Sleep-related breathing problems is one of them. Now, it's the worst one. It's the one that causes the most problems for the most number of people. 1 out of 4 people has sleep apnea. I'm one of them. You might be one of them too. It's the most common thing there is in sleep medicine. But it just depends on if, we might need to repeat a sleep study if there's a new sleep disorder. Sometimes people come in, they say, well, my husband now he's thrashing at night. We might need a new sleep study for that or something like that. Yes, ma'am.
So is CPAP the only solution to?
CPAP is not the only solution for sleep apnea. How much time do we have?
You want to finish out another 5 minutes of questions? Let's do that.
Do you mind if I come back to your question? Sure. And anyone who wants to know about sleep apnea treatments can stay at the end, and I'll do a mini session on that because it's not a quick answer. It's a good answer, but it's not a quick answer.
Anyone else?
I dream a lot. And,
Good.
And I dream wild dreams. And there's a relationship between that and urinate. Is there any?
Yes. So the question is, if you have a lot of dreams, is there a relationship between dreaming and urination? So yes, I think I understand your question. Here's what I'm going to say. People who urinate multiple times a night, typically they are not breathing properly. If you urinate more than twice a night, typically people are not breathing properly. When you are not breathing properly, your oxygen gets low. And when your oxygen gets low, many people, not all, but many people will have wild dreams, nightmares. Sometimes they can have dreams. I know from when my sleep apnea was untreated, it was always something chasing me and I could never get away fast enough. Some people dream that they've got something stuck in their throat. Some people just dream bad dreams. Oftentimes, nightmares or unpleasant dreams can often occur with more frequently with bad oxygen levels, which usually mean some type of sleep disordered breathing like sleep apnea. Not always. Dreaming is normal. We're supposed to dream. And sometimes we can have dreams that are, quite frankly, weird. And, we don't even know why we dream. As like a science, we're not even really sure why we dream yet. As in medicine, science yet. But I do know that bad dreams, stressful dreams, and urinating multiple times a night typically occur together and happen in people with worst case of breathing.
Can you hear me?
Yes, ma'am.
Okay. How about autoimmune diseases that might have connective tissue? Ever since I had lupus, I'm in remission, but I still can't sleep. And then another quick question was, I go to sleep 1 hour and wake up.
You need a sleep study. I want you to get my card. Those are very specific and a little more rare. So I would like to see you, or you don't have to see me. I want you to see a sleep specialist because I think you're going to need a sleep study. At least one at home, possibly one in the lab. Okay, there are a lot of autoimmune disorders out there, and they can cause. There are some autoimmune disorders that cause a loosening of connective tissue, which can cause worsening of your throat collapsing while you're sleeping. There are some autoimmune disorders that can cause autonomic issues like racing heartbeats at night or things like that, or stress in the body at night. You might possibly need a sleep study for that, okay, is the short answer.
Okay, that's a lot of information. Thank you so much. And it sounds like Kelly is willing to huddle up with people that want to look at some of the devices and some of the options for sleep apnea. Kelly also has her cards at the back. So anyone that wants to pick up a card, do that, and the number is also on your handout. So thank you so much for coming in, Kelly. Thank you for all your wisdom and your enthusiasm about sleep.
I love to help people sleep. It's my favorite thing in the whole world.
Thank you.
So anyone that wants to talk about sleep apnea treatment, just come on up here and I'll show y'all some of the newer, the latest and the greatest.